Hello, wellness friends. I hope you enjoyed part one of our conversation with Dr. Julia Huber, who is a licensed lifestyle medicine consultant in the states of Kentucky and Virginia. In part two, we get in a little more depth about what she does and also talks a little bit about her coaching practice that is not limited by the borders of Kentucky and Virginia. So please enjoy part two.
I've just got so many questions that I ask, particularly from a trauma-informed standpoint. And like I said, that would be like a whole other, that'd be a whole other conversation together. And after that, we come up with a plan together. It may be that I think, gosh, this person really is so sleep deprived, they might want to work on that right now. But it may be that there's something a little bit more pressing for them. It may be the food. It may be that they want to get more connected with their bodies. And we may have to go at it tangentially at first and kind of sneak up on that. I don't know if that makes any sense to you, but sometimes, sometimes people are very disembodied or disconnected from their body, particularly when they've been under a tremendous amount of stress. A lot of the people that I coach are physicians themselves, healthcare workers, people under a massive amount of stress. And I see a phenomenal survival trait of disconnecting from bodily needs. You don't have time to go to the bathroom. You don't have time to eat. You don't have time to drink fluids. You don't have time to sleep. You don't have time with your family. And the only way to kind of make it through that is to just put your blinders on. And at the end of the day, then people start getting diseases that are stress related. So how do you work with that? Sometimes you work with that by reconnecting with the body. That may involve movement. There may be some sessions with me where we move around. We know from research studies having to do with trauma that trauma impacts the body and can lead to disease. We also know from the work of a very well-known psychiatrist, Dr. Bessel van der Kolk, that once we get an emotion, we can start moving through some of that. Once you start moving on that end of things, sometimes people sleep better. Sometimes they make healthier food choices because they have more of a sense when they're hungry. So it all kind of interconnects. So it really, really depends on the specific patient and what they choose as a top priority for them. And go ahead.
Well, I can sense something with you that you are very passionate about this. And I recently had an accident and I had to have a surgery. And you hope that your surgeon is someone who is happy and that they love what they do. Now, obviously, physicians are people too. And I think we put a lot of us put physicians on a pedestal and we think that they're always in a good mood and that they're always at the top of their game, where in reality, that's impossible. But you seem like this transition to a lifestyle medicine physician has created some passion with you. And I think that at least what I'm sensing is that you love this because now you're getting to do what probably you were trained to do, which is assess the person as a whole and then treat them. And you get to know them, they get to know you, and it just seems like this is the way medicine should be. But unfortunately, it's not the way medicine is currently being practiced. So I just see the passion with what you're doing, and I find it very refreshing.
Thank you.
When I do these interviews, I try to find something that the audience can kind of take away from the interview. And you just touched on something that I think is very important today, but it's not maybe talked enough to patients about. And that is, you just said sleep. And I noticed when I was looking at your website, that's one of the things that you talk to your patients about is sleep. What are, in your opinion, what are some of the things people can do to try to get better sleep? And then how do you think, just as an opinion, how do you think sleep affects us as far as our overall health?
Wow, we could talk, we could talk for so long about this. These are great questions. Thank you. In terms of sleep hygiene, I think what's important is that we know that there is a connection between chronic disease and lack of sleep. And this has to do with hormonal changes that occur once we are in deep sleep. We know that, for example, that there's a correlation between sleep deprivation and obesity. We know this. And I think that's really important for people to realize, because it may just be that a change in their sleep hygiene is the pivotal step towards them being able to lose weight. They may say, hey, I keep trying all these different diets and nothing seems to work. And once you work on the sleep hygiene end of things, then people actually are able to start feeling more refreshed and losing weight, for example. I think what you're talking about in terms of general recommendations is what we call sleep hygiene. One thing that I think is a huge culprit, and I think the public is fairly aware of now, is screen time.
Okay.
I think the most important thing that you can do, and you can actually do this, I do this on my iPhone because, otherwise I don't have that little external reminder that says, hey, we're going to kind of dim down right now. And guess what? It's time for quiet time. I'm just still raring to go in the evenings. So we need that wind down time. And you can actually program it. And if you've got an iPhone, you can program it into your phone to kind of shut down the intensity. And for me, I actually have Facebook set up so that it has like a little sleepy picture that says, hey, you're in quiet mode. So what we need to do is just get off the screens, turn them off, remove them from your room. So we need a dark, quiet place. And we also need a bit of a bedtime ritual. We need outside cues. It may be that you do a little bit of yoga, maybe take a shower or a bath, maybe you have your cup of tea, just wind down so you can kind of quiet yourself a little bit. And I think this is important. It's a good time to reflect on your day. And I really encourage people to keep a gratitude list. And I know that sounds a little bit cheesy, but there actually is evidence that people who are actively grateful or even thinking about gratitude feel better. And these are not necessarily people who have spotlessly wonderful, perfect lives. Sometimes these are people who are tremendously suffering. But people in the act of expressing gratitude feel happier and more fulfilled. And I think this connects in with sleep. It's kind of like a roundabout way of answering your question, but this is a good opportunity. Keep a gratitude list. Keep some thank you notes around. And as you're kind of winding down, write some thank you notes. Send someone a little message. So those are some things that you can do is really get in the habit of settling yourself down and decreasing your light exposure. You also need to consider, are there some medical aspects to not being able to sleep? And this is where I, as a physician, can really help. Sometimes people can have all sorts of abnormalities, some of which require referral to a sleep specialist. And we can do a general screening for that. Sometimes people have airway issues, they're snoring, they've got sleep apnea. Sometimes they've got imbalances of hormones. For example, women who are perimenopausal are going to be getting hot flashes. Do we need to address that? Some of that can be addressed with change in diet. Sometimes people need to be sent off to their physician for further evaluation. So you really have to look at medical causes too, to make sure that people are safe sleeping, that there isn't some type of physiological reason why they cannot sleep. And then I think this, speaking for all of us this week, as we're speaking, we're in the middle of, I don't know where you'd call us in the pandemic, but we're on what year like a season 3 of of that episode,
Right.
season 1 of Ukraine. I have to confess, I'm not sleeping too well this week, and I think a lot of us feel that way. There's a lot of unrest, a lot of anxiety, depression, stress, worry, and that's where it's really helpful to have a mindfulness practice. And it doesn't have to be complicated. Even if you just take one deep breath, just one deep breath in through your nose and then very slowly let it out through your mouth. And if you just kind of hold your belly and soften that, we call that belly breathing. You just do that a couple times and settle yourself down. This is something that's used with people who are trauma victims, people who are having flashbacks, people who are anxious. That's a wonderful technique to use, is belly breathing. And I learned that at a lifestyle medicine conference from someone who had worked with people who were witnesses to a mass shooting. And he said, this is the technique that I used. He was working with some of the high school kids. And he said belly breathing is really, really helpful. So those are all things that I would recommend in terms of actual sleep hygiene, if that's helpful for you.
Yeah, I as I've gotten older, I've realized that my sleep isn't as good as it was when I was younger. And one of the things that I'm finding personally is that when I go to bed affects the night's sleep that I'm getting. I tend to want to go to bed earlier now, but then that sometimes I'll wake up 2 or 3 o'clock in the morning and feel like I'm wanting to get up, but I'm telling myself, no, you shouldn't get up now. And then the Apple Watch has a sleep tracker on there, and I tend to obsess a little bit about that. What a person that I know had a great point. They asked me, well, how did you sleep last night? And I went to my phone and clicked on the sleep tracker, and I said, well, it looks like I slept okay last night. And they looked at me like, you mean you had to go to your phone to tell me how you slept last night? And I was like, well, that doesn't make a lot of sense, does it?
Yeah, there's a little bit of a disconnect there.
Exactly.
Yeah, I understand. And I think this is our society right now. I think we're all functioning at some level on a disconnect. I think that the pandemic has been so hard and the losses have been so tremendous. And I think that the levels of anxiety and stress are so high that it's hard for us to notice that. So I think it's good to notice that and name it and just say, wow, I'm obsessing a little bit, and my friend just caught me in a complete disconnect from my body.
Yeah.
And so I guess an inquiry around that is how do I want to be in my body? What is it like to be in my body?
Right.
You know, and it's just wonderful to explore that, not in terms of like making yourself sleep or, to make your tracker look better or whatever. And maybe even when you're not trying so hard to sleep, you might want to take the opportunity to just check in with your body. Am I sleepy? What does it feel like to be sleepy? I know that when I was in my training, I lost the sense of thirst because, you work in the ER, you're working 12-hour shifts. A lot of times you just can't get to fluids, or you don't want to drink fluids because then you have to go to the bathroom and you can't run to the bathroom. And so you just don't drink fluids, right? And it's taken me years to have to kind of almost retrain my mindset. And sometimes I'll just feel a little bit uncomfortable and I have to almost go through a list and say, okay, am I thirsty? Am I hungry? Am I anxious? Am I sleepy? What do I need right now? And
You just said,
kind of start connecting a little bit more with those signals, because your body does have a lot of signals
right.
that it wants to give you. And so the signal right now is out, as you pointed out, it's outside of you. So how can you get back into your body to the point where you have a sense of recognizing those signals?
Well, you as a lifestyle medicine coach, is it teachable? Is that something that's teachable to people to learn or relearn how those signals that your body is giving you to actually be mindful to those, and then and listen, but actually listen to your body, because what you're saying is that we have gotten so distracted that our body is probably talking to us, but we've forgotten how to listen to it. So what you can do is retrain us or teach us how to listen again. Am I right about that? Or
I think you're really, I think you're getting the idea. And I think that's where yoga comes in. And yoga is not for everybody. I'd be the first one to say that, but that's where movement comes in. And it may be that that a lifestyle medicine prescription would include, say, walking in nature. Because we know that when people are exposed to, we call it the blue and the green, exposed to nature, even they did a study where people had a flash of the outdoors that was, I think, less than 1/100th of a second. Even those people were able to relax, even with a flash of nature. So I would recommend even going outside and starting to get in touch with your senses as you're walking. Not everybody does well with yoga. That can be very uncomfortable or unsettling for people. People have joint pain, or maybe they're just really active, busy people. And so maybe those are modalities for them. Maybe they're not. But for someone like you, I would say just get yourself out in nature every day, even 5 to 10 minutes. And then just start doing a little bit of a scan of your senses. Name 3 things that you see. Name 3 things that you hear. And then just do your walk. And then when you finish your walk, name 3 things that you see. Name 3 things that you hear. Because it is possible to pull yourself back into the present moment. And there's so much relief with that. Because you don't have to fix anything. You don't have to judge anything. You don't have to try harder. You can just enjoy that moment. So that would be, I say, probably entree for people. But at the end of the day, this is where I get uncomfortable when you ask, can you train people? Because that puts us back in this this power dynamic. So I would say no, because we're back to the outside trying to push something onto the inside of you. And so the decision making, and this is what takes a little bit of processing with people in coaching, for example, is to have that decision really be from here, from the depth or essence of your being, right? And that's where that work comes in. It's a little bit more subtle, and that's very different from training you. I mean, your tracker trained you to look at it, right?
We did an interview, I think 2 years ago. Did you know that there's a Buddhist temple in Kentucky?
Is that Furnace Mountain?
So Furnace Mountain.
I have not been there, but I have heard of it.
Well, we went there and did an interview, and the thing that I took away from that interview was that effectively what people are doing when they come is it's a silent retreat. So they come and they sit in silence. But as Degak was explaining to us, they come and they sit, they reflect, and then every day they take walks. And as they're walking, they're basically doing what you just said, is they're reflecting, they're listening, they're actually being in the moment, as opposed to,
yes.
You were talking about walking, and I take walks, but sometimes I take the walks just to take the walk. In other words, I'm saying I'm going to do a 2-mile walk, and I'm not paying attention to what's around me or what I'm hearing. I'm just doing it to do it.
Sure, you're getting your steps in for your
I'm getting my steps in again.
I got you figured out now.
So he was saying that when they come to his retreat, that all that's gone.
Yes.
You're introspective, and you're doing things that are beneficial to you that you typically don't do when you go back to your hustling, bustling life. So, but it was a really neat place. It was a really beautiful place. And if you ever get a chance, I would suggest that you go and
that sounds
see
wonderful. I love places like that.
It's really neat. And
Yeah.
it's beautiful. I mean, it's there's so many places in Kentucky that are beautiful, but not only is the surroundings beautiful there, but the temple was beautiful, and the Dagok was a beautiful soul to meet with. So, and it's 45 minutes from Lexington, so it's relatively close to. Listen, Julia, I could talk to you all day.
I could talk to you all day too. I'll keep going.
But
so many things to talk about. Yeah.
So I think what we should do is we should probably put a pin in it here, and then maybe have more conversations in the.
I would enjoy that. I would welcome that
in the future.
Yeah. Like me, these are wonderful conversations to have, and they just open up, new ideas.
Sure.
Your questions have left me just kind of thinking just a little bit more about what I do. So I just want to thank you for that. It's opened my mind up just a little bit more. So thank you.